Speaker.
The Honourable Annette King.
Mr Speaker, talofa lava. Mr Speaker, there is a tradition in New Zealand to give the budget a name. And I mean, you can think back to the black budget or the mother of all budgets or the chewing gum budget or the block of cheese budget, and Nick Smith endeavoured to give it a name this week. He called it the best budget he'd seen in 25 years, but of course no one took any notice of anything that he says because he's inclined to become over-emotional at times, and he's the person who wants people to live next to an exploding substation. But no, the person who has given the budget its moniker this year is the Prime Minister. The Prime Minister, he has called this budget, it won't make a blind bit of difference budget. That's what this budget is going to be called. It won't make a blind bit of difference. Because and why the leader of our country would want to use blindness to make his point is another matter. But the Prime Minister, he said, when bringing in a new tax under the guise of a levy, under urgency in the dead of night, said it would not make a blind bit of difference to people wanting to travel. Of course, he didn't say that when he flew to London, first class no doubt, on behalf of the taxpayers, to argue with the UK government not to impose the same sort of tax, and he called it a tax at that time. He said it would not be good for New Zealand. It, in fact, would hurt New Zealanders travelling. But, of course, he didn't mind it being put on here in New Zealand because the most who will pay it at the end of the day will be New Zealanders. Of course, he did stand on principle, his principle, that a levy is a tax and a tax is a levy, and if you don't know, Google it. He then said it would not make a blind bit of difference to the number of people enrolling if they got rid of the $1,000 kickstart to KiwiSaver. Wouldn't make a blind bit of difference. Of course, they forgot that they said in Budget 2011 that they'd never take away the $1,000 kickstart. You know, but then they do stand on principles, their principles, don't they? Mr Speaker, Speaker after Speaker from the National Party have exploded with pride that they, after almost 7 years of urging and shaming, have increased the benefit for families with children who are on the benefit by $25 a week before tax and deductions at about $2 a day. But of course it's so urgent. I heard them last night in passion speeches about, look what we've done. We've increased the benefit. After 43 years, we're the first government to increase the benefit. Forgot to say they were the first government in 43 years to reduce the benefit. First government to reduce the benefit. But they proudly say the first in 43 years to increase the benefit. There's such hardship out there, that is why they've done it. So why, and not one of the national members have answered this question, why do these people in such hardship have to wait 10 months for it? Why are they waiting 10 months before they get any relief, but they're taking the money from the KiwiSaver, the $1,000 kickstart from the KiwiSaver, that starts immediately. But the money's coming in, but it ain't going out to those who they said were in such hardship. Oh, the amnesia of the National Party. I've never seen so much propaganda pumped out in such a short time frame. You see, they have forgotten many of the things that they did. And of course, the Minister of Finance and Nick Smith, who is the brains trust of the National Party, they're the ones that voted to cut the benefits way back then. They've also forgotten. Oh, and I'd like to remind the new members who don't have a lot of memory about what their party did in the past, but it was in 1999, not that long ago really, that the Minister of Finance, who was Bill English, by legislation reduced the net weekly average payment of superannuation from 65% to 60%. He cut the amount old people were getting by legislation in this House from 65% of the net weekly average wage to 60%. Have a look at the papers. Ask Bill to show you the papers. He wanted it to be cut to 55%, but he was stopped. And it was the Labor government who restored super back to 65% of the net weekly average wage. Now let's, Mr Speaker, get on to the part of the budget that I was incredibly interested in, and that is the health budget. Well, we're told we've got more money, and I have to say, it's not if there's more money, it's how much more. How much more has been put into the budget? Does it cover the costs of running the health system in New Zealand? Some of you might have been awake in December when I released in this House a leaked Cabinet paper on what Cabinet had agreed would go to DHBs. That Cabinet paper said they would receive $320 million. They would receive money towards demographics and a contribution towards cost pressures. The Minister of Health stood in this House on a number of occasions and said, I was wrong, you couldn't trust anything I said, this was not correct, this was not what had gone to Cabinet. Mr. Speaker, can I tell you, the Cabinet paper was 100% correct, even down to allocations that individual district health board received. So I wasn't the one that was wrong. I have to say there is a word for what the Minister did in this House, but perhaps I won't use it today, Mr. Speaker, just because you're a very good Speaker indeed, and I wouldn't want you to tell me off. But what I'd like to do is to read from that Cabinet paper, and perhaps the members opposite weren't given this bit of information. What did Treasury say if health was given $320 million? They said there are some major fiscal risks sitting in Vote Health, stemming from the wind-up of Health Benefits Limited, that fantastic organisation that has cost millions of dollars of health money, who got a kick in the teeth yesterday when Hawke's Bay District Health Board said, take your health plan to send down food from Auckland away, we're not interested in it. So there are some significant risks coming from Health Benefits Limited being wound up, and the Terra Nova Pay equity claim. In announcing a funding signal of $320 million to DHBs will now make it, listening everybody, extremely challenging to manage the pressure in Vote Health within a $400 million package. What did they get in health? They got $396.5 million is the funding health funding package. It was going to be a challenge at 400, and they even got less than that. Treasury also said DHBs will be required to achieve combined efficiencies of around $121 million. So all your DHBs are going to have to go out there and find efficiencies, and they're already under huge pressure. There is no doubt, Treasury went on to say, that the financial pressure facing DHBs are considerable, particularly in terms of the upcoming wage negotiations. Mr. Speaker, I have to tell you who the losers are in this health budget, because it's obvious the members opposite haven't been told anything than the bright, shiny story that the Minister of Finance, the Prime Minister and their Minister of Health will tell them. There are many members sitting on the back bench there who are members of rural constituencies. Well, I'm afraid to tell you that your constituencies are the losers. Rural health in New Zealand is a loser. And it's no wonder rural doctors and rural pharmacies are dismayed. You see, what you find is that rural pharmacies, rural doctors have been told that there will be no increase in the rural health workforce retention. And the member who's taken over from Bill English ought to know that down in his area and all around the rural areas of New Zealand, it is very hard to staff the rural doctors, rural pharmacists, rural health providers. Well, the poor old pharmacists, they've really been hit. They've got a 0.37% increase in one of their services only, which amounts to 80 cents a month per patient. That's what they got out of this budget. You will find, members opposite, but the rural GP flexible funding has been decreased. And then there are all the small rural hospitals around New Zealand, and the biggest losers come from the southern part of New Zealand. Their DHB got a 1.89% increase, not the 2.8 or 2.4, whatever the government said they'd got. They got 1.89, and that is why I have to tell you, Mr. Speaker, that they have written to Minister Coleman from the community following 1,000 people attending a public meeting saying, we have resolved a vote of no confidence in yourself as Minister of Health. And this is why the funding of health services is ultimately your responsibility. You decide with your cabinet Cabinet colleagues on the priorities on government expenditure, quite clearly running 2 public referendums, as reported, cost over $26 million on a New Zealand flag is far more important than using it for rural health services. Those health services in Dunstan, Alexander, in Gore, in Balclutha and Queenstown are under threat, and they are likely to close services or close altogether.
I call the Honourable Hekia Parata.
Talofa lava, Mr. Speaker, tēnā koe.